Welcome to the Menopause Stories podcast. I'm your host, Dr. Tamara Beckford, founder and medical director of Truly Balanced Wellness Care. This is the space where we stop the guesswork and start the optimization. We're pulling back the curtain on that midlife hijack and giving high achieving women the clinical roadmaps and unfiltered stories they need to reclaim their edge. Let's get into today's story. I'm excited because today we have a wonderful guest, and we were just talking before we jumped on. We're like, there's one day that something happens, which is what podcast is about, but there's so many years that's circling around it and circling behind it. What are we not talking about? So I have today the wonderful Miss Tony Will. She's going to introduce herself. She's going to tell us all about what she's doing right now, and she's going to let us know, when did she know? When did she really know that, you know what? Something is changing. Go ahead, Tony.
Oh, thank you, Dr. Beckford. It is such a pleasure to be here. Yeah, my name is Tony Will. I am from Kalamazoo, Michigan, and born and raised here, never left. And I am the general manager of a men's professional hockey team for the past 11 and a half years here in Kalamazoo. And I also have my own coaching business as well around lifestyle coaching, specific to help people who want to reduce or remove alcohol from their lives. I live alcohol free and have for the last 5.5 years. I'm a mom. I'm a wife, I'm a daughter, and an author. My book comes out August 11th called Rebellious
Woohoo.
Six. Yes. Oh, and I'm also a podcaster too. Women In is my podcast. And so when did I notice? Ironically, and I don't know how backed this is by research, but on my birthday last year, literally, started waking up with night sweats on my 47th birthday. I'm like, what is this?
Happy
And
birthday to you, Tony.
it was like these 3 days where I was night sweats, night sweats, night sweats, and then it went away. And now they're periodic. But then I also started to experience, I've struggled with general anxiety disorder since my early 30s. And in the middle of the night, I started to wake up with panic attacks. And so my doctor said that it could be part of perimenopause as well.
Yeah. Can you imagine? Now, the thing is that you're going about life and there's so many things that you have going on. Like you just described your litany a descriptor, right? Hi, I'm Tony, but I'm also A, B, C, D, E, F, G, all the way. And then on top of that, you're celebrating this wonderful milestone. And then boom, hot flash.
Yeah. And it's interesting because I've always been someone who's cold on the colder side. And so he
In
was like,
Michigan.
exactly. He's like, why are you wearing so many clothes? Maybe you're sweating for that. I'm like, no, it's something different. You can just tell.
Yeah.
And as my birthday's coming up again in the next month, and so I'll be 48 this hockey season. I'm in hockey arenas a lot for my job. And now I'm to the point where I'm like, I just want to go lay down on that ice.
You're like, fellas, move over. Let me just lay down for a few minutes before you
Ah,
proceed.
yeah.
Wow. So the hot flashes, waking up in the middle of the night. So there are two things that you've mentioned that disrupt, and sleep is a huge disruptor, right? That we talk about it, but we're like, yeah, sleep. But when we really get down to nitty gritty, we know how important sleep is. And you have two things that's disrupting your sleep. You have the hot flashes and then anxiety. So how are you the next day? Like when these are happening? How is Tony that morning after?
Number one, I noticed that, and I don't know if this is TMI for the, but there's like a funk to that sweat. It's
Mhm.
just, and it doesn't feel, it's different than just being a little hot when you're sleeping.
Mm.
So I feel like, oh, it's one of, ooh, I need to shower, get clean,
Mhm.
just almost wash away what this new stage of my life is, because it is this mindset shift of holy cow, like you don't know when it's coming. And
Mhm.
I'm a person that has an IUD. So I haven't had a period in 13, 14 years. So there's no period symptoms because I don't have one. And
Mhm.
it's just through these other symptoms that I'm experiencing. So I'm waking up. I want to wash this off, get these clothes into the hamper, and I'm not as rested. And the flip side of that, though, I will say, since I quit drinking alcohol, is it's I know what really feeling like crap in the morning is, so this I can tolerate.
You're like, I've been to the extreme. So that, but also what not having alcohol as a part of like your diet and even quote unquote your relaxation or anything as a part of your life is that you can attribute this directly to the symptom. So there's no, maybe this is a flush from the wine that I had last night. No, that you said you've been alcohol free. So you know that this symptom that is waking you up, it is related to there. That
It
hot
is.
flash is perimenopause.
Yeah, and you just know it.
Mhm.
That is helpful. And also a lot of reading and research I do related to alcohol and now perimenopause as I'm in this stage of life is understanding that I'm doing myself a favor. Like my symptoms could be a lot worse if I
Yeah.
were drinking on top of experiencing perimenopause.
Absolutely. Especially when you're talking about, we talked about the hot flash, but also about the sleep overall, getting restful sleep. There's so much that when one is having and imbibing, and this is not to say that you shouldn't, because I mean, I still
Mhm.
have alcohol, but I know what's going to happen. I might not have restful sleep. Okay. Are you willing to take that risk? Or is it something that you're like, I really cannot survive that next day, and therefore this is just not going to be a part of my life? You have to make such great decisions for yourself. Now, one of the things we talk about, we're talking about life, we're talking about perimenopause, and we're talking about sleep, but let's talk about anxiety. Now, tell
Yeah.
us about that. You said that you have suffered with anxiety during your early 30s. Had you
Mhm.
gotten to the point that it was feeling more controlled and then boop, 47, hey girl, guess who's back?
No. So my anxiety story is really interesting
Mhm.
because one day in my early to mid 30s, I can't exactly remember what age I was, but I was in a meeting at work and it felt like a lightning bolt went through me. It was bizarre.
Oh,
And then all of a
wow.
sudden my heart rate started to rise and fall. Rise and fall. So I thought something was wrong with my heart. When you have an anxiety attack or panic attack, you literally think you're having a heart attack or dying.
Mhm.
So I was taken to the emergency room and they did all the tests and they said, "No, you're super healthy. You just had a panic attack." And
Mm.
I'm like, "What?" So then I was afraid to have one again because they're
Yeah.
just so disabling. What happened was at that point, all those years ago, I was prescribed Xanax as needed.
Mhm.
And I would take it if I needed it. And primarily when I needed it, I never abused Xanax, but whenever I needed it was when I was flying. There I
Mm.
had a lot of anxiety. I did notice though the correlation between my anxiety and alcohol over the years. As my alcohol intake increased, so did my anxiety.
Mhm.
And that was one of the many reasons why I decided to quit drinking. There were several,
Mm.
one of which I just didn't like my relationship with alcohol, but I didn't want the anxiety. So
Yeah.
when I quit drinking, my anxiety went away.
Yes.
Now, I thought, "Oh, I'm a non-drinker now," and it's gone. 18 months later, it came back, and it came back worse than ever.
Really?
And this was during COVID that it came back. So I
Mhm.
don't know if the correlation between what was happening and it was scary. It was
Mhm.
after I got COVID for the first time, but it
Mm.
was crippling at that point. And that's when I went to my doctor. And I really did want to be on Xanax situationally because I know it hits the same part of the brain as alcohol. And I just didn't want to
Absolutely.
keep tapping
Yeah,
that
feeding
reward
that
center.
receptor. Yeah.
I did exactly. I didn't wanna do that. He recommended I get on Lexapro and
Mhm.
SSRI, and I did, and I'm so glad I did. And
Mm.
I'm an advocate for anyone what medication on medication, you do you. Everyone has their own choices, but for me, Lexapro helped. Then what I found out as I started going to perimenopause and I took that to my doctor, he said Lexapro is used to help manage symptoms of perimenopause. And
Mhm.
so when I had those panic attacks in the middle of the night, then they upped my dosage. And so I'm not having the panic anymore that was coming from these symptoms. So the lesson in all this is the pattern is as and I'm sure is a great podcast, so she'll aptly point out is that I'm talking to my doctor about it. I'm not
Yes.
just keeping it in myself and suffering in silence.
And that's a great point that I really want. I'm glad that you're highlighting that for our ladies who are listening. I'm saying our ladies who are listening. I know that some of our listeners are males, but we honor that this is probably a predominantly female space. And it's important for our ladies to feel safe. And in one of the portions in feeling safe is talking about things that are uncomfortable. And this right here is something that's very uncomfortable because a lot of us suffer silently because we see it as a source of shame, anxiety from the outside, it can have a stigma that so you can't keep things under control. But anxiety is something that comes out of nowhere. And as you aptly described, it can be so crippling that I can imagine you having to go to the emergency room. I'm an ER physician also, in addition to taking care of women in menopause and perimenopause. So I see the ladies coming in with this and doing the full workup. But what I'm glad that you have is that you have a provider who listens, because that's what we try to provide for our women. And that's one of the number one things that I'm hearing, is that we're not from the space as providers to those who are patients. We're not listening enough to our patients. So I send kudos to your doctor who you have such an open relationship with them that you can say, listen, I am not feeling well and I'm noticing this, and they listen and make adjustments.
Yeah, and I do. I feel really safe in talking about it. I'm also not afraid to talk about tough topics. Stigma
Mhm.
is a topic in general. When I chose to quit drinking, that is highly stigmatized topic.
Absolutely.
And most people don't want to talk about it out loud because to your point, that too is viewed as a weakness. And I'm
Mhm.
out here to argue that no, this is a strength. And so anything, but menopause, perimenopause too, because listen, I don't know about you, but my mom didn't talk about this stuff.
Nope.
And I think our mothers and that boomer generation, they suffered in silence. So we're all sitting here looking at each other. What is
What
this?
is that? What just
How did they function?
Yes.
And I work in a male dominated industry. And
Mhm.
so and not that I run into the board meetings and run into these other meetings I have with all these men in pro sports and say, I'm in perimenopause, you treat me different. But it does affect our day to day. And so it's just a
Absolutely.
reality of
Mhm.
being a woman and talking more openly about it. And that's why I love podcasts like this or other podcasts or books I've read on this
Mhm.
topic because it's helped me say, okay, A, I'm not alone. B, I'm not crazy. And there's different ways to look at this.
Absolutely. I love that you mentioned the "B I'm not crazy" part. Now, that is something that happens so much to women who are going through this phase. And the part that is challenging is, as you mentioned, number one, is that this phase of perimenopause, it's a long phase. So it's not just, okay, those last 2 years, woo. No, when you really look back, it's many years. It can be as long as 7 years or even a little bit more for some women. But that within those 7 years, there's so many subtle changes that happen. But women, you're so used to adjusting. So these subtle changes happen and you have adjusted and adjusted. But then if you were at this point right now, think about the last 5 to 7 years. Was there more than just the hot flash and the anxiety that is now giving you that inkling? Oh, you know what? You are right. That might have been also one of those symptoms of perimenopause.
Yeah, a common one
Mhm.
is the weight gain and midsection in
Yeah.
particular. And literally, when I woke up at 40, I looked down, I'm like, where'd you come from? What's this? And over those between now and 48 in a month, it had, and every year I'm like, I just joke now that I look like a baby seal. Like I have this extra layer of fat and I'm shiny and sweaty, but I'm still cute. So
I love it.
that's how I'm embracing it because I work out, I eat right, I drink a lot of water. I'm not perfect, but I do take care of myself. I take my supplements, all these things, but it's just coming regardless of what I put in my mouth.
Mhm.
Oh, that is another thing that I have noticed and really giving myself a lot of grace. And I'm trying to look at the positive because along with the menno belly has come some bigger boobs, and my husband's not complaining about that. So
Kudos to you.
so that you try to women are our culture depending on how I'm a Gen Xer and we're
Mhm.
raised in a generation of skinny and diet culture and all this
Yes.
and it makes it even harder when we go through this transition. So I really encourage women. I'm passionate about just we're not supposed to be our high school weight. We're not supposed to look like we're 22 when we're 47 or whatever our age is. And we are
Mhm.
not defined by the number on the scale.
Absolutely, absolutely. And that's a great position, especially to honor this phase of our life where we're transitioning. How to honor that, where you're looking at, you understand the changes, the physiological changes that's going on, and understanding why it's happening. That lady that I'm calling her a lady that came and added to that midsection to give you that hug. So that's basically she came and hugged you right around that midsection. She understands this is me recognizing that my body's going through this transitional and physiological change. And that physiological change is menopause. And my hormones, guess what? They're saying bye bye. Gen Xers, bye, 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 bye.
We know it back
Yeah, but at the same time, honoring this portion of our lives by doing the things that you can control. So things that you've mentioned, right? I am still exercising, I am still eating, I am still taking my supplements. I do recognize if I wanted to physiologically change some of these things, there are things that I can do physiologically. But there are also some things that it doesn't matter. Guess what? It's going to happen.
It is, and it doesn't change our value. If anything, if we can look at this, we can say, I am grateful to go through this stage of life because I'm above ground and I can experience this. We've all lost people in our lives, and some very close women that I grew up with died in their 20s that were my best friends. And they're not able to experience this stage of life. So instead
Yeah.
of looking at it as a burden, maybe it's a gift because I'm reaching this next era. And I would say this back half of my life is going to be even better than the front half because
Yeah.
I did all the hard stuff. In the first 48, 50 years, you do all that coming of age crap. Now I'm like, I'm set up. I'm good to go.
Yes, and that's the mindset that I really want a lot of our listeners to embrace, that this isn't the, "Oh, woe, not woe is me." Like you said, "I no longer look like I did in my 20s. I'm gonna be out to pasture. Just roll the wheelchair out and just let me wither away." It's no. Like, how powerful is it to have all the wisdom from all the work that you've done in this first half, to bring that with you, with this powerful body that we have, along with this powerful mind filled with experience, filled with joy, and to experience another 30 or 40 more years, because it all is matter. Like, how are you approaching this? Are you approaching this as woe is me? Or are you approaching this, oh, I cannot wait? And you know what? They're not ready for this. That's my approach anyway.
Me too. Me
Yeah.
too. And this is my time. My three kids are all young adults. They're raised, and this body has done a lot. I brought human life into this world, and I've accomplished a lot as a mom and also a career person. And now I'm able to go back and focus on me. And part of this and what we talk about is in terms of being a woman is what it is now is what helped create life
Yeah.
and sustain life and do all so I want to honor
Why would
that
we
'cause
be ashamed? Yeah, why would we be ashamed? Let's talk about how in your career, how were you able to, when these changes were happening, to navigate your career at the same time? It would catch you off guard, but were there any adjustments that you found yourself making and that you're still making now in order to still be successful in what you do, understanding like this is just a different phase of my life than the 20s and 30s?
Yeah, I'm really fortunate because what I do for a living is working in professional sports and I have the head seat at the table and being a
Mhm.
woman in that space is very rare. There's only 5 of us in the world that are women that do this
World.
job.
Wow.
World. Yeah, most of the general managers are men's pro hockey, which makes
Mhm.
sense. I happen to be one of the few women. And so I am able to lead by example. And by that, I give this part of my life language. My staff is younger than me, and
Mhm.
I talk about it, but not in an uncomfortable way, but just
Mhm.
more in, hey, can we turn the AC up? I'm hot. And they're like, Tony, it's normal. And I'm like, I'm in perimenopause and allowing them to just know that. But we're very close. So it's
Mhm.
not an HR violating kind of way, but just the
No, what
reality of
I like
it.
is just how it was just a normal statement. It's just, "Hey, can you close that window shade?" And it's like, "Why?" "Because the sun is glaring me at this point." It's in the same realm as that. "Oh, I'm in perimenopause." "Oh, the sun is glaring and I can't really see that well with that glare." So it's normalizing it because it is such a normal part of our life. But when we think about it, we end up having to take this deep breath in before we ask that question. But I love the fact that you just know it's
It just is. When I was pregnant, I would just say, and I wasn't feeling well, I just say, I'm pregnant and I don't feel well. So what's the difference on the other side? That's how I view it. And my hope is that it just, again, brings some compassion and understanding to others that are going to go through this eventually, or someone in their lives are, whoever they're married to, their mom, their kids, whatever.
Absolutely, absolutely. As you're saying that you would love for for us to be able to normalize this, what is a message that you'd have for the next generation? I love that you said that a lot of people that you work with are younger. So you are leading by example, by even just being who you are and just being authentically you. What is a message that you'd love to leave for the next generation who's coming up and watching you that you'd say to?
That bring your whole self to, and if I'm talking professionally, to work.
Absolutely.
We were raised in a generation of you check all you check yourself at the door, all your emotions are out the door, and you're a different version at work than you are at home. And I'm
Mhm.
not saying be unprofessional, but what I'm saying is just be you, wholly you. You don't
Mhm.
need to check any version of yourself at the door, and bring that person to whatever work you are doing. Don't create two versions of you. That's too hard to manage.
That is so true. It is hard to manage. And then you have to remember when one's achy breaky, oh, how does this person react versus this one, right? But if you're being authentically you, then you will respond appropriately no matter what, because you're responding authentically as oneself. Now, we've alluded to this earlier about this great relationship that you have with your doctor, and that you can be so open and your doctor is willing to listen and adjust. I myself, as we stated, am a doctor who help women in perimenopause, menopause, and I want to make sure that they get excellent care. So I always pull information and pull advice from my guests. What advice would you give me to make sure that I can provide the best care to the women who are coming to being part of my practice? What is one thing that you'd say, you know what, Dr. Beckford, if you do this, make sure that you provide this for these ladies?
I'm sure you already provide this, but the so much has changed, and I haven't done this yet, so I just want to preface this right now, but I'm very open-minded to it for hormone replacement therapy, HRT, and that open-mindedness of this is not back in our parents' generation, our moms, it was like, it causes cancer, and it's
Mhm.
not like that anymore, and really shortchanging women, and this is such a great tool. So I guess my just be open-minded, which is clearly you are, because I could
Mhm.
tell.
Absolutely, absolutely. Being open-minded to women who want the support during that phase, and that's definitely the hallmark of what we do in Truly Balanced Wellness Care. And there's a reason why I named it Truly Balanced Care, because I want you to really feel that care and to feel literally truly balanced in your life professionally, emotionally, and all that starts at the core, which is what we do. Alrighty, I told you that I always have a fun question.
I'm
So my
ready.
fun question of the day is: what song would you say that you can use as a soundtrack for your life, either when you were going through the worst part, or is your soundtrack right now? Or it could be the lyrics, either the
Now,
song or the lyrics.
I'm sure someone has given this answer, but this is where I'm at right now, which is this girl is on fire.
Is it from the flashes, or is it just that you just don't get
Both,
it? Both.
both. This girl's on fire. She's hot all the time, and I'm kicking ass in life.
Yes, I love it. I love it. I love it. Alrighty. We'll be adding that to our soundtrack, our
Awesome.
menopause stories podcast soundtrack for all our women out there. So, is there any last words that you want to leave? I want to really thank you for joining us here. But any last words that you want to leave for our listeners?
No, I love this type of forum and platform about women lifting each other up and supporting each
Mhm.
other through what it is to be a woman, because it's challenging, and you're not alone, and you're not crazy, and you're in the right place, and you've got great resources here. So I'm glad they're listening to your
Oh, thank you so much. Like we said, ladies, you're not alone. And I will be the first to let you know that I do not take it for granted that you have taken the time out to listen to this podcast. We hope that you enjoyed this wonderful conversation and know that, yes, we might be on fire, but we are also fire. Because that's how we look at you guys time. You've been listening to the Menopause Stories podcast. If today's conversation hit home, don't let your story stay stuck in that midlife hijack. Head over to the show notes to book your strategy session and to join the movement of women redefining their power. I'm Dr. Tamara Beckford. Stay optimized, stay bold, and I'll catch you on the next episode. This episode is brought to you by Truly Balanced Wellness Care. Most high-level women are told that their labs are normal while they're struggling to lead through brain fog and fatigue. At Truly Balanced, we don't settle for not sick. We architect for peak performance. Whether you need a 30-minute hormone strategy session to audit your labs or are ready for our 3-month Jumpstart Intensive, we provide the physician-led roadmap to get you back to your best. Visit the link in the show notes or go to www.trulybalancedwc.com to secure your spot. Now, back to the conversation.